Hi guys, so in this short video we're going to talk about the difference between primary and secondary hyperthyroidism, something that's frequently asked to both UGs and PGs. So before we start the discussion, I recommend that you guys take a screenshot of this screen because this table that I've put here has all the important differences and you can use it during your revision. So how we'll approach this is first we'll talk a little bit about primary hyperthyroidism very briefly, then a little bit about secondary hyperthyroidism, and then we'll compare both. So coming to primary hyperthyroidism, this is also called Graves' disease. Okay, so primary hyperthyroidism, it happens due to production of autoantibodies. So in Graves' disease or primary hyperthyroidism, there are stimulatory. So I want you to remember the word stimulatory. Stimulatory autoantibodies are produced, and these antibodies stimulate the thyroid gland to produce more thyroid hormone, leading to hyperthyroidism. So stimulatory autoantibodies. So in case of Graves' disease, the symptoms of thyrotoxicosis like weight loss, heat intolerance, diarrhea, all those things that you've read of. So those symptoms of hyperthyroidism or symptoms of thyrotoxicosis appear at the same time as the swelling. So both the swelling and thyrotoxicosis features appear at around the same time. Graves' disease has a younger age of onset, approximately 15 to 30 years of age. And most importantly, Graves' disease is associated with something called Graves' triad. So this is something that you guys have to remember. There's something called a Graves' triad. So as you know, triad is three things. Firstly, ophthalmic. So the Graves' ophthalmopathy or the eye signs of thyroid disease, thyromegaly or the thyroid gland enlargement, and something called pretibial mixed edema may or may not be associated with clubbing. So this together, pretibial mixed edema and clubbing, is considered as thyroid acropathy. So the triad includes gland enlargement, ophthalmopathy, and pretibial mixed edema. So if you see any of these features, you should consider your diagnosis to be Graves' disease or primary hyperthyroidism, because eye signs and pretibial mixed edema are never seen in secondary thyroid hyperthyroidism. And then coming to clinical features, in case of primary hyperthyroidism or Graves' disease, there is predominantly CNS symptoms, so such as anxiety, sleeplessness, that impending fear. So all those CNS symptoms, increased alertness. So all those CNS symptoms predominate in case of primary hyperthyroidism, and it is a differential for an anxiety disorder. So primary hyperthyroidism, predominantly you see CNS symptoms, and the reason for this is they have suggested, or there is studies saying that because there is a disruption of the hypothalamo-pituitary axis in case of this. So the stimulatory antibodies stimulate the thyroid gland, there's feedback inhibition of TSH and disruption of your hypothalamo-pituitary axis. So this disruption leads to a predominant CNS symptom in case of primary hypothyroidism. So on examination in primary hypothyroidism, there is a diffusely enlarged gland. So the whole gland increases in size. You can see in this image, it's a butterfly shaped gland. So usually the whole gland increases in size. So diffusely enlarged gland, which is smooth. Okay, a multinodular gland, it has a nodular consistency. So here you have a smooth feel. It is warmer because there's increased blood supply. There's increased thyroid activity, increased blood supply. So it's warm, and there is bruit again because of increased blood supply. So diffusely enlarged, smooth, warm gland with bruit is typical of primary hyperthyroidism or Graves' disease. And lastly, the toxic symptoms, the features of hyperthyroidism that we discussed, have a sudden onset and are more severe in cases of primary thyrotoxicosis. Okay. Now next, let's talk about secondary hyperthyroidism. So secondary hyperthyroidism is also called plumber's disease, right? And here the features of hyperthyroidism start long after the thyroid swelling is seen. So there is usually a history of a long-standing thyroid swelling. So that is, the thyroid swelling precedes the hyperthyroidism. So here the patient has an enlarged thyroid gland for about 15-20 years, and after that they start noticing the features of hyperthyroidism. So the classical example for this is a long-standing MNG, person with a long-standing MNG who later starts developing hyperthyroid features. So that's called toxic transformation of a long-standing MNG. So secondary hyperthyroidism as compared to primary has an older age of onset, usually between 25 to 40 years of age. Eye signs are very uncommon. There are no eye signs. So if you see thyroid ophthalmopathy or the Graves' ophthalmopathy, you have to think of primary itself and not secondary. So eye signs are uncommon, and here, unlike in primary, there are predominantly CVS symptoms. Okay, you will have breathlessness, and there's more predilection for them to develop congestive cardiac failure. So heart failure is more common in secondary hyperthyroidism, And this is proposed to be because usually people who develop secondary hypothyroidism are of older age, so they are more susceptible to cardiac issues. And also long standing and a gradual increase in the hormone output leads to increased demands on the heart and can precipitate congestive cardiac failure. So basically all you have to remember is serious symptoms like breathlessness are more common, palpitation, breathlessness are more common with secondary hypothyroidism as compared to primary. And here on examination the gland is nodular because it's a long-standing MNG that usually leads to secondary. So it's nodular. The gland is not diffusely enlarged. It may be unevenly enlarged. A nodular surface, and bruit is rarely heard because there's no rapid increase in blood supply. And toxic symptoms in case of a secondary hypothyroidism have a gradual onset and are milder as compared to primary. So in brief, things you have to remember is in primary the swelling appears along with the hypothyroid symptoms, whereas in secondary the hypothyroid symptoms appear long after the swelling. CNS symptoms are more common in primary. CVS symptoms are more common in secondary. Eye signs and the Graves triad are never seen in secondary but are seen in primary. So if you just go through the table once more, you'll get a rough idea. But this is really important for you to know the differences, and you can see the pictures of ophthalmopathy, pretibial myxedema, enlarged gland, and all those things in this one slide. So take a screenshot and review the table once more, and you'll be thorough with this topic. Thank you.